Hey guys, this is your health coach Rahul, and let's talk about methylene blue today. Sometime back, I had posted about methylene blue and its benefits, how it can be used to biohack your health and improve your longevity and general health. Uh, I wouldn't call it general health, but actually in health in all aspects. And methylene blue is a wonder drug. It's actually a dye which was accidentally found to help treat malaria. Let's dive into it. Let's dive into the information of methylene blue. Let's understand how we can biohack our health, how we can improve our immunity by simply consuming methylene blue in small dosages every day. And more importantly, it is absolutely safe to consume. But how to do it? What are the tricks? What is the information that we all need to know before we dive into using methylene blue as our biohacking mechanism to improve our health, immunity, and take our health to the next level? So let's dive into it. So a little bit history about methylene blue. In 1891, German physician and Nobel Prize recipient Paul Ehrlich pioneered the use of methylene blue in the treatment of malaria. Ehrlich discovered that methylene blue would quickly concentrate in the brain and selectively target diseased tissues in the body. Methylene blue is called a magic bullet for that reason. And methylene blue has since been used to treat dementia, cancer, chemotherapy, malaria, methemoglobinemia, urinary tract infections, cyanide poisoning, and carbon monoxide poisoning. How we age, that's important to understand, and where does methylene blue come into the picture of aging, or rather anti-aging, or longevity as we call it. As we live life, our brain chemistry and metabolism changes. Mitochondrial energy levels decline, attention, memory, and mental agility decline. Tau proteins and amyloid plaques clog the brain. Free radicals damage brain cell mitochondria. Cerebral blood flow declines. All these things are happening as a part of aging process. All of these changes can happen at any age. And why any age, especially more importantly for today's population, younger generation, who's exposed to so much processed food, sugar, carbohydrates, toxic food which is grown in the agriculture practices where a lot of pesticides and chemicals are used to grow the food. We are constantly exposed to toxins, and that's why today's younger generation is in fact more at a risk of aging faster. So all of these changes can happen at any age and are a product of the food we eat, what we drink, lifestyle habits, and the air we breathe. Methylene Blue is here to rescue us, and it's a very simple over-the-counter found drug, or a dye you can call, which we all can use. Methylene Blue helps age-related cognitive decline by boosting brain cell mitochondria energy levels and improving cerebral blood flow. It's very important. We can do a lot of exercises to improve the cerebral blood flow, but what if something can cross that blood brain barrier and help us increase the cerebral blood flow without giving us any side effects? There are a lot of drugs which can do the same action, but they all leave some kind of traces, and when I say traces, those are side effects. At low doses, methylene blue has been shown to protect the brain from diseases by acting as an electron donor to the mitochondria, which increases adenosine triphosphate, ATP. ATP is the currency of life, as we all know, and the energy that powers humans. So, at the end of food, how is food used by the body? Food is converted into glucose, and then ultimately through the Krebs cycle, it is converted to ATP. So ATP is the currency of life and the energy that powers humans. If our production of ATP declines, our physical and mental performance declines. Even healthy individuals can benefit from a boost in ATP production. Methylene blue is also able to increase the amount of NAD plus produced by mitochondria. So NAD plus and NADH, they are again a part of this energy formation cycle. And what methylene blue does is that it takes the load away from NAD and NADH and gives its own electron for the production of this cycle. And as we age, the decline in the ratio of NAD plus and NADH is basically one of the primary reasons for us to experience fatigue and aging. So, what does methylene blue do? Methylene blue takes the load away from NAD plus and NADH and gives its electron, it donates its electron for the production of ATP. But what happens as a result of this? The ratio of NAD plus and NADH increases. That is what happens, and that is the boost that we all need as we age to increase our longevity, to increase our energy levels, to increase our repairing processes. So this is the very important part that methylene blue plays. It improves the ratio between NAD plus and NADH. This is a different topic. We can expand on it later, but just understand this. This is the crucial part that methylene blue plays in our longevity and health and energy production. More energy our cells have, the more ability to fight infections, inflammation, and also do activities, brain clarity, so many things. Low dose methylene blue provides memory enhancing effects, boosts cognition, works as an antidepressant, is anti aging, helps dementia, Huntington's, Alzheimer's, is antimicrobial, and even slows skin aging. So methylene blue is an antidepressant. Methylene blue is a monoamine oxidase inhibitor. It inhibits MAO-A more than MAO-B, but inhibits both at large doses. Methylene blue resists Alzheimer's disease. Alzheimer's disease and other forms of dementia are also associated with a buildup of protein tau. Clinical trials show that methylene blue inhibits tau formation. Methylene blue is anti-aging, increases mitochondrial complex 4 by 30%, enhances cellular oxygen consumption by 37 to 70%, enhances biological pathways and reverses premature cell aging. Methylene blue improves memory. A low dose of methylene blue increases brain activity and improves performance in memory tasks. Methylene blue is an antifungal agent and may inhibit candida. Methylene blue makes you feel young again, eliminates social anxiety. You will feel focused and more confident. Workouts seem easier because you have more energy. Your mitochondria are energized. Methylene blue helps eliminate stress and improves sleep. So you have more energy in any situation with a relaxed state of mind. This is the beauty of methylene blue. It works on so many aspects of our life and our health that it just opens up an entire window of health and feel good factor. Methylene blue improves your cognitive functions, your mitochondrial health enhancer, delays cellular aging, enhances key mitochondrial biochemical pathways, improves cellular and mitochondrial function, and decreases the production of proteins linked to Alzheimer's. I mean, do you even know any single drug that can have so many different qualities, positive qualities, without leaving any kind of side effects on you? It's amazing. How it works? Your brain's neurons rely almost entirely on mitochondria, derived energy. So, failure of mitochondrial function can affect the rest of your body, but it's particularly detrimental to your brain. This is where methylene blue steps in as one of the most important anti-aging and neurological disease preventing biological agents. Methylene blue quickly crosses the blood-brain barrier. It improves mitochondrial efficiency and respiration, acts as an antioxidant, and increases brain cell lifespan, resulting in improved memory and mood. At low dosages, methylene blue is used to enhance mitochondrial function, increase cerebral blood flow, and acts as an antidepressant. I mean, we can repeat this again and again several times, but the benefits just keep on growing and growing and growing. Methylene blue improves memory by increasing brain cell respiration, or how the brain cell utilizes oxygen. It increases ATP production to provide more cellular energy for better overall brain function, including cognition, mood, and memory. Methylene blue is an antioxidant. Methylene blue is a metabolic enhancer and an antioxidant. Methylene blue binds to superoxide and reduces it to water. It stops the oxidative cascade at its very beginning before it gets a chance to do damage. So several studies will give you introduction of methylene blue. The chemical name is methylthioninium chloride, as also known as methylene blue, was the first synthetic drug, as we've seen the history, used in clinical therapy with a wide range of use. Methylene blue has found applicability in several areas of engineering, biological sciences, and health sciences. Due to its anti-inflammatory, antioxidant, neuroprotective, and anti-parasitic properties, methylene blue has been considered a multifunctional drug with uses at preventive, curative, and post-operative care. So it's not only as a preventive medication, but curative and also post-operative. So the main clinical indications of methylene blue are for the treatment of malaria and methemoglobinemia. The pharmacokinetics effects and toxicity of methylene blue have been major topics of investigation. Studies have shown that methylene blue exhibits not only adequate absorption rates by gastrointestinal tract, but also peak plasma concentrations occurring between 1 to 2 and 5 to 6 hours after oral and intravenous administration. So methylene blue can be taken in all different ways. It can be orally taken, it can be kept in the mouth and let the mouth absorb it. It can be taken as an IV. So various ways methylene blue can be taken, because methylene blue is hydrophilic. Low doses can cross the blood-brain barrier and act on brain mitochondria, inducing greater energy production and decreasing cell toxicity. Additionally, methylene blue acts as a redox mediator for nicotinamide adenine dinucleotide, that is NADH, oxidizing intramitochondrial substances and functioning as an alternative electron carrier. So what is NADH? Let's dive into that. Let's understand what NADH does to us. So methylene blue, so this is one of the studies, what basically, it's on sciencedirect.com, and you can see over here, it's a part of a study. Combined activation of energy and cellular defense pathways may explain the potent anti-senescence activity of methylene blue. Highlights of this study: methylene blue transiently increases the ratios of NAD, NADH, and PAMPK and AMPK. Now, all these enzymes, NAD, NADH, they are all involved in the process of energy production. And the ratio between these two keeps on decreasing as we age. But beautifully, what methylene blue does, it comes here in picture. Moment we take it, it says, don't it's kind of telling someone, listen, I'm here now, don't worry, I will do your work. And methylene blue beautifully donates its own electron instead of letting NAD and NADH do its work, and helps in ATP production. But what happens over a period of time because of this is that the ratio between the NAD and NADH, which was on a decline, now starts increasing, now starts restoring, as a result of methylene blue donating its electron for the process of ATP generation. So methylene blue induces PGC1 alpha, SURF-F1, and complex 4 biogenesis. So these are all different topics for different day. Oxidants production as well as telomere erosion decreases in methylene blue treated cells. So the damage to telomere is also a part of aging. So the more the telomere damage, faster the aging. But here methylene blue comes in and also decreases the damage to telomeres. So methylene blue activates the metabolic pathways of self-defense and energy production. Methylene blue, a potent anti-senescence agent in vitro, may be also effective in vivo. So I wanted to focus on this third point over here, which is quite interesting. And it tells us what they have found in this study. So those were the highlights earlier. Now the results. Methylene blue increases the ratios NAD, NADH, PAMPK, AMPK, and induces PGC1 alpha. Following 15 minutes of treatment of IMR 90 cells with methylene blue, the ratio of NAD and NADH increases by 63%. We are going to leave this topic over here because it's a huge topic in itself. But what we need to understand basically is increase in the ratio between NAD and NADH is a clear sign how much methylene blue actually helps us in energy production and longevity. This is good enough for us to learn today. We also have another thing. So what NADH, what kind of role it plays in ATP production. So this is one more thing I would like you to know. NADH provides electrons by aerobic ATP production. So this is where methylene blue comes, and it donates its electrons for aerobic ATP production in cells deprived of oxygen or with impaired electron transport chain activity. So methylene blue can also play a role in increasing your strength endurance activities or endurance activities. So it's an amazing drug. NADH accumulation can be toxic. So if as a part of aging, NADH can accumulate and become toxic, but methylene blue comes and helps us generate more energy, and this accumulation also stops. To minimize such toxicity, elevated NADH inhibits the classical NADH producing pathways, glucose, glutamine, and fat oxidation. So you can see over here accumulation of NADH, which again is a reflection of reduction of the ratio between NAD plus and NADH. Uh, inhibits means slows down or basically stops the pathways of glucose production, glutamine, and fat oxidation. So that's going to again affect your energy production. So let's go back to this study over here, and this has been methylene blue has been proven to treat malaria, acute clinical conditions. Uh, this has successfully been used for years, more than 100 years now. But now there are newer drugs which are treating malaria. Uh, Methylene blue is also used for treating septic shock. Septic shock is characterized by profound changes in the hemodynamic profile. These changes include increased cardiac output and persistent hypotension resulted from arterial vasodilation and overwhelming response to a systematic inflammatory reaction. The condition is the leading cause of non-coronary morbidity and mortality of patients admitted to intensive care units. Even in developed economies, septic shock has been a challenge for health agencies. The high prevalence and mortality rate of this condition have supported studies aiming at different treatment approaches, among which the use of methylene blue seems encouraging. So, this is a simple, cheap, over the counter drug, but as we all know, a lot of times these studies are suppressed or not given enough importance because this is not a money making machine. So, in septic shock patients, the administration of methylene blue improves hemodynamic status through an increase of the cardiac index and systematic vascular resistance. Furthermore, the two studies included in the review report that methylene blue administration was safe and no adverse effects were observed. And here we are talking about patients who are in ICU. So chronic discogenic low back pain, methylene blue also has been used in treating chronic discogenic low back pain. This condition is characterized by degeneration of invertebral discs. A lot of times you know people around you who have got slip disc, and just by generating more energy in the body gets ability to fight back inflammation and the pain can reduce. The pain associated with the condition usually worsens upon sitting, coughing, or sneezing and relieves on standing up or walking. Pain radiation to the lower extremities and neurological symptoms such as numbness, weakness, urinary incontinence are advanced signs of disease. So methylene blue administration may be an effective alternative treatment for the condition via denervation of small nociceptive fiber. Additionally, it acts as reducing inflammatory processes of disc degeneration by inhibiting the production of nitric oxide. So these are some amazing benefits of using methylene blue. Bipolar disorder and post-traumatic stress disorder. Methylene blue has been used for psychiatric disorders for more than 30 years. A significant reduction of residual symptoms of depression and anxiety in patients with bipolar disorder has been associated with the use of methylene blue. See, methylene blue is one of those amazing drugs, over-the-counter drug, which is available for us. It's a nootropic. It can cross the blood-brain barrier in lower dosages and increase the cellular function inside the brain. And this is what the result what we get. It is used for treatment of brain disorders. So methylene blue has shown to be a promising adjuvant treatment. Its effect on psychological disorders has been widely addressed by the literature. A recent study showed that methylene blue enhanced the effects of imaginal exposure therapy, in which a patient is asked to imagine feared scenes or situations. It could be associated with the fact that methylene blue improves memory retention and learning, in addition to having significant effect on quality of life. This is just amazing. I mean, refractory neuropathic pain, again, just like earlier, the slip disc. This is used for patients with chronic pain, and it basically inhibits the level of nitric oxide, and in a certain way, it is helping also in reduction of pain. Methylene blue, some other details we can go through. Let me check what I want to. As a nootropic, methylene blue quickly crosses the blood-brain barrier, as we discussed earlier. It improves mitochondrial efficiency and respiration, acts as an antioxidant, increases brain cell lifespan, resulting in improved memory and mood. Let's see if something else that we want to focus here on. Neurotransmitters. Methylene blue inhibits monoxamine oxidase and acetylcholine mitochondrial neuroprotectants. This is something important. Methylene blue also basically works as a neuroprotectant. Methylene blue is a potent antioxidant. Reactive oxygen species are produced inside mitochondria. The first free radical that is formed inside a cell is superoxide. Methylene blue will bind to superoxide and reduce it to water. Amazing. It stops the oxidative cascade at its very beginning before it gets a chance to do damage, and that's how it improves even the skin. Bad skin or the skin that is aging faster, at the root cause of that also is oxidative stress. And methylene blue, that's why methylene blue, moment you start taking methylene blue, it also improves your skin. What else I would like to discuss? This is the history of methylene blue, how it works. So this is the diagram where we can focus on how methylene blue basically works. The citric acid cycle is important for the methylene blue. You can again see NADH and NAD plus over here. The ATP is generated at the end of the cycle. But methylene blue comes and it kind of donates its electron and takes the load away from NAD plus and NADH. So that is the beauty of methylene blue. So methylene blue functions as an alternative electron carrier in the electron transport chain in mitochondria. It accepts electrons from NADH and transfers them to cytochrome. Cytochrome complex is a component of the electron transport chain in mitochondria, playing a role in apoptosis and as an antioxidant. So, amazing work methylene blue does over here. Methylene blue also stimulates glucose metabolism. Taken together, increases in CMRO2, and glucose uptake means that methylene blue elevates oxygen consumption, which helps glucose increase ATP production. So increases in ATP production provides more cellular energy for better overall brain function, including cognition, mood, and memory. Methylene blue also is around antioxidant, but other benefits. Researchers tested methylene blue in animal models of neurological disease. First, researchers used rotenone, a potent pesticide which causes severe dopamine depletion in part of brain associated with Parkinson's. Methylene blue rescued brain cell mitochondria from damaging effects of this toxin by donating electrons in electron transport chain broken by rotenone, especially bypassing the broken transport chain with donated electrons as an alternative electron carrier. So this is simply amazing. I mean, researchers purposely damaged brain cells by using rotenone, and these damaged cells were repaired moment methylene blue was given to these rodents. And the same thing happens in the human brain. Any damaged cells in the brain, basically methylene blue helps them recover faster, and that's why Alzheimer's and dementia, they all people suffering from memory loss. Methylene blue is amazing for brain clarity, for better functioning of the brain. Methylene blue is an amazing supplement. How things go bad, let's revise again on these things. As we live life, our brain chemistry and metabolism changes. Mitochondrial energy levels decline. Attention, memory, and mental agility decline. Tau proteins and amyloid plaques clog the brain. Free radicals damage brain cell mitochondria. Cerebral blood flow declines. All these things will improve by simply taking methylene blue. And that's the beauty of this simple blue colored dye. All of these changes can happen at any age, as we all know. And methylene blue is the beautiful, simple, over the counter drug that we all can use in low dosages. Uh, what else would I want you to see here? Yeah, I mean, for all the people who are into exercising and exercising fanatics, research shows that methylene blue is an effective anti-aging nootropic. Methylene blue increases mitochondrial complex uh, by 30%, enhances cellular oxygen consumption by 37 to 70%, increases heme synthesis, hemoglobin, and reverses premature senescence caused by H2O2 or cadmium. Methylene blue is considered a redox agent, meaning it cycles between oxidized and reduced forms. This cycling by methylene blue helps block oxygen production in brain cell mitochondria. Mitochondrial complex is the last enzyme in the respiratory electron transport chain in mitochondria. The mitochondrial complex 4, so that's what we are talking about. The last step in synthesizing ATP, your cellular source of energy. Iron or heme is an essential element and participates in oxygen transport, DNA synthesis, and electron transport. Heme synthesis begins in mitochondria. Every cell requires heme to function properly. Senescence or biological aging is the gradual deterioration of cellular function and is caused by telomere shortening that triggers DNA damage in response to reactive oxygen species, hydrogen peroxide, cadmium, and other toxins. Methylene blue helps prevent premature senescence or premature cell deaths by repairing the telomere damage. So these are all benefits which we are repeating again. We have seen this before. Methylene blue clinical research. Research into methylene blue for its therapeutic value goes back to late 1800s, but it's only in the last couple of decades that scientists have been able to decode exactly how methylene blue works in the brain, all the way down to the molecular level in the mitochondria. A study in 2017 found Alzheimer's disease could be caused by more than accumulation of amyloid beta in the brain. The scientists looked into two main components that produced energy in cells. Glycolysis is the mechanism used to convert glucose into fuel within mitochondria. Again, if you focus on keto or low carb diets, that also helps Alzheimer's because it reduces the dependence on glucose and it increases the dependence on ketones. Again, that is an environment that the brain needs if you're experiencing Alzheimer's or if someone is epileptic or someone experiences seizures, then a ketosis environment in the brain, in the body, is an ideal environment for healing. And add methylene blue to it, it will do wonders. Creating this fuel in mitochondria uses oxygen in a process called mitochondrial respiration. The researchers found that as the brain ages, mitochondrial metabolism deteriorates, resulting in the reduction in the molecules needed for energy production, and possibly the main culprit behind many neurological diseases, including Alzheimer's and Parkinson's. And methylene blue here helps us. The researchers found that as the brain ages and mitochondrial mechanism or metabolism deteriorates, resulting in the reduction in the molecules needed for energy production, and possibly the main culprit behind many neurological diseases, including Alzheimer's and Parkinson's. A study conducted at Children's Hospital Oakland Research Institute may have found a solution to the mitochondrial energy problem in brain cells. Ketosis or keto diets have been successfully used to treat seizures, epileptic seizures, Alzheimer's and dementia and all brain related things. So you just add methylene blue to low carb or a ketosis diet or a keto diet, and it will really do wonders. It has been proven. The researchers found that methylene blue can prevent or slow the decline of mitochondrial function. One of the key aspects of Alzheimer's is mitochondrial dysfunction, specifically complex 4 dysfunction, and this is where methylene blue steps in. The study found that methylene blue enhances complex 4 in mitochondria. It increases oxygen consumption and it reverses premature cell death. The researchers conclude that methylene blue may be useful to delay mitochondrial dysfunction with aging and the decrease in complex 4 in Alzheimer's disease. Beautiful. Methylene blue improves memory. We all know that methylene blue helps bipolar disorder, again, a brain function improvement. Methylene blue recommended dosage. Now, this is what we all need to focus on. Methylene blue dosage. Recommended safe dosage based on clinical studies with animals and humans ranges from zero point 0.5 to 4 mg per kg. So, for a 90 kg body weight, it translates to about 45 to 360 mg of methylene blue. So if you're going to take it in drops, which is kind of 1 mg or 5 mg, so you have to just multiply it and then do your mathematics and then take the dosage. The bottom line is there is no true recommended dosage for methylene blue. The recommendation to start with is 0.5 mg per kg and see how you react. Methylene blue is water soluble, so you don't need to take it with a meal or healthy fat like some nootropics. Methylene blue has a half-life of about 5 hours, so you can dose twice a day. Methylene blue is famous for turning urine blue, but for most neurohackers, your urine will only stain blue at doses roughly exceeding 500 mcg. Some recommend preventing blue urine by mixing methylene blue with ascorbic acid for 3 hours before taking it. Ascorbic acid is vitamin C in pure form. Methylene blue is also available as a doctor-administered injection for therapeutic use, typically used to treat diseases like malaria or with anti-cancer therapy. Methylene blue, for your information, has also been successfully used in coronavirus treatment. And please follow Dr. Govalkar. He is in Gujarat, and there's a Dr. Govalkar's protocol for treating COVID infections with methylene blue and other drugs. And it is a wonder drug. It can treat several diseases. Methylene blue side effects. Methylene blue shows a hormetic dose response with opposite effects at low and high doses. In other words, low doses of methylene blue work well as a nootropic, but high doses do not, because methylene blue can potentially steal electrons away from the electron transport chain, disrupting the redox balance and acting as a pro-oxidant instead of antioxidant. So adverse effects for methylene blue also come from chemical impurity. Even pharmaceutical USP grade methylene blue can contain impurities like arsenic, aluminum, cadmium, mercury, and lead. At low doses, these contaminants are not that big of a problem, but higher doses will result in accumulation of these toxins in your cells. Side effects with methylene blue are rare when doses are under 2 milligrams per kg, but can include stomach pain, chest pain, dizziness, headache, sweating, confusion, high blood pressure, shortness of breath, accelerated heartbeat, tremor, skin turning blue, urine turning blue or green, reduction of red blood cells, or jaundice. This sounds very scary, the last paragraph, but trust me, it is not as scary as the simple drugs that you take over the counter and the antibiotics that we are prescribed. So this is very safe. You should take a USP grade methylene blue or a 0.01% methylene blue. It's available on Amazon. CTZ is the company. CTZ methylene blue. It comes already a diluted solution, which you can take like half a teaspoon every day in the morning on empty stomach. Keep it for about 1 to 2 minutes in your mouth and then gulp it, take it inside. Or the same half a teaspoon can go into a glass of juice and you can have it with that juice, and that will also do its job. So methylene blue also is available in a homeopathic prescription. You can go to your homeopath and also get prescribed with methylene blue. But yes, it's in very different method that homeopathy will use methylene blue, and it's not blue in color. It just comes in the white color pills. So this is what the entire thing is all about methylene blue, and my constant effort is to bring to you some quality information, quality biohacks, so we all can improve our health We all can improve our immunity. We all are able to be in a place where we can fight infections in better way. If you have any questions, if you have any queries, how I use methylene blue to biohack my health, longevity, and how I help my clients with methylene blue in my practice, you can always get in touch with me on my email address, that is mygeneticnutrition@gmail.com. My is MIGENETIC@gmail.com, or you can WhatsApp me on 95 942 9 777 4, and you can fix the consultation with me uh, regarding the queries you have for your health. So this is your health coach Rahul Patil from My Genetic Nutrition, signing off, and take care, stay well, and be fearless. Cheers.